We are a CBD shop that cannabis and today I have Dr. Annabel Fountain from Fountain Health, who is an endocrinologist and an internal medicine doctor. So what is endocrinology and how does that relate to medical?
Well, endocrinology is the study of hormones, and hormones are the chemical messengers in our body that travel around from a gland like your thyroid in your blood and affect every single cell in the body. They have receptors on each cell, and they all work together. And the endocannabinoid system is really similar in that we have cannabis receptors, different kinds of cannabis receptors on every cell of our body. And so for me, it really, really makes sense that that cannabis is something that is good for us. And we don't know very much about it as a medical person. It wasn't talked about at medical school. And I learned about medical cannabis for the first time, I guess it's probably 20 years ago, where there was a drug that was a cannabinoid receptor antagonist, which means that it was blocking cannabis receptors, and it was used for diabetes and weight loss. And I thought that's really, really interesting because, of course, we all hear about cannabis giving you the munchies, right? And it also makes you happy. And this drug was withdrawn. It worked really, really well for the weight loss, but actually it made people depressed. So that was really, really interesting. And now, of course, cannabis is becoming legal. And it's been illegal for more than 100 years, and therefore a lot of medical research has been missed. It's really delayed. So we're now learning about it more, we're seeing all the potential benefits, and I think we should be able to use it as a tool, just like I can use Tylenol, or I can use insulin, or all these other medications that I can prescribe for my patients. Why can't I use cannabis?
And so there are over, of course, 100 different cannabinoids, but obviously the cannabinoids that we know of are most common are THC and CBD, but they actually can be found in other plants such as cacao, which is vitamin E, dark chocolate, it's vitamin E, great. But the main difference is the levels of THC, CBD, and THC. That's the levels of THC. And that's where most of the medical research is sort of informed on, and psychoactive elements of THC. But I guess what we wanted to do today is just provide more awareness and education, and explain the reason why our bodies react so well to these cannabinoids because of that endocannabinoid system that we have, and it's responsible for our immune, digestive system, our immunity. And cannabis also has vitamin C, vitamin B12, and antioxidants. So there's so many benefits to this plant that many people don't know. The fact that the female is the one that produces the flower. We have a little replica here. We have the bud here, and then also the terpenes that we smell. There's a huge benefit to that. Some of the smells that we recognize are lemon, baby, lavender, and there's terpenes that are responsible for our calming effects, they have antifungal properties. So there's so much packed into this one plant, and it's important that we get that information out there to everyone and effectively explain the difference between the hemp and the marijuana plant is that the hemp produces lower levels of THC. Typically, there's products that have 0.3% of THC, so it's less psychoactive. And it's important to understand the psychoactive element, because that's when you can have adverse reactions if you have too much psychoactive or too much THC. So a full marijuana plant has actually about 20 to 25% THC in it, so it can get quite high levels of THC. So it's important that you know that it's good to microdose, and you take a little bit at a time and know your dosage.
Yes, absolutely. I think the way that most people first encounter psychoactive chemicals would be alcohol, right? So with alcohol, you learn that you can have one glass of wine, and then you have to have spritzers, and you definitely can't drive if you've had two, right? So that's kind of helping you to understand your body's reaction to that drug, the alcohol. And with if you have a drink where you're pouring the drink where you've got rum and ginger beer, if you think of rum being the THC and ginger beer being the CBD, if you have a lot of CBD, you're going to have more pain relief, anxiety relief, calming, being able to sleep better, those kinds of things. And if you have more of the rum, which is the THC, then you have the sort of energizing effects, which quite often can induce anxiety and even psychosis. So if you have a high amount of THC and you don't have a high amount of CBD as well, it can actually cause psychosis, and that is the thing that I think I'm the most worried about. And I think that if you talk to politicians or doctors at Maui about cannabis, they're worried about the strains of cannabis that are very high THC without maybe enough CBD, because it's a balance, right? So when you pour your drink, you want to know like how much can you handle, just like you would, when you choose your cannabis strain, you want to think of it the way that you would an alcoholic drink. How many units can you take before you get an adverse effect, right? So I think that's really important. That's part of what this education is. It's not just, all cannabis is fine, because the THC content of some of the strains that we have now, 2,000 times more than the weed that your parents smoked in the 60s, right? And that's why we get the adverse effects. Some people like it, but that's not medical cannabis. That's a high, that's a drug, more for recreational use. And what we're talking about are the medical benefits of cannabis.
And I think that's one of the important reasons why Uplift is set up, to provide that education, to provide that awareness about it, and to work in conjunction with the cannabis associations, with the drug abuse, so we can provide that information so that people are misinformed. So it is important to know your dosage as it were, and it's important to microdose, especially because you can be allergic to cannabis.
Of course,
there are many reasons why one would take cannabis, and also I know that the studies show with young people that minors and 18-year-olds, they shouldn't be taking cannabis, which is another reason why we have our age to 21 and up. So it's a lot out there that you need to consider, and it's important that you have a safe and healthy environment. And we encourage ones to go to ones like Uplift, no matter where you are, cannabis dispensaries. They can explain to you what you're having, what dosage you should take, recommended usage. Just like you wouldn't sit there and eat a whole Tylenol bottle.
That's right.
You wouldn't eat the whole pack of gummies.
That's right, absolutely.
It's important to be informed.
I think it's very, very, very important for Bermuda that there's this option. Buying street drug of anything, you don't know what's in it, right? So you hear about drugs in the US being laced with fentanyl, and that can actually be in cannabis as well. And fentanyl is a drug that's used for anesthetic, and there's a lot of accidental overdoses and deaths in the US from these drugs from the street that nobody's regulating, nobody knows what's in it. When you buy a product from Uplift or another dispensary, there's actually nutrition facts and information about what you're going to get, right? So we chose this because it says Dr. Endo, right? I have not tried these. But in Bermuda, if you only have access to street drug, and perhaps you're using it for anxiety or for sleep, or you're using it for pain relief, and there's so many different potential benefits for people with cancer, MS, glaucoma. Like, you're using it for a very, very medical reason, and yet you're getting it off the street. Potentially, you're going to get something that gives you a significant high that might and very little benefit for the reason that you're there. So having this availability and educating the public so that perhaps they'll be more comfortable coming into a dispensary where they can say, well, I'm finding it really difficult to sleep and I have pain. They're going to be recommended product that is focusing on those issues rather than just a high. Exactly. I think it's really, really important. It's also really important that when it does become approved for medical prescribing, that your physicians and pharmacists have training. Because like I said, we didn't learn about cannabis in medical school. It was illegal, and we need training as well so that we understand all the different possible combinations, just like Tylenol and codeine, right? So you have cocodamol, it can come with different doses of codeine, right? And so we want to understand the different doses that we're giving someone, not only of THC and CBD, but also the terpenes and the other cannabinoids, so they get the most benefits and the least adverse effects.
Well, thank you for your time. It's amazing, and I'm sure we'll have many more educational sessions.
Thanks for asking me.